Hi, Kayla. Thank you so much for being here today.
Yeah, thanks so much for having me, Michelle.
Can you tell me a little bit about yourself and your practice?
Sure. So my name is Kayla Thorngate. I am the owner of Nourished Mothers. To tell you a little bit about myself, I am a registered dietitian and an international board certified lactation consultant, or IBCLC for short. It's a mouthful for sure. But in my practice, I help women optimize their diet and feel their best when trying to conceive throughout pregnancy and in the postpartum period, especially if they are breastfeeding. So I kind of combine that piece of being a dietitian with an IBCLC. I also, in my own practice, I have a desire to dive deeper into why women are experiencing certain health issues and treat them as a whole person. Because I feel like this is really missing sometimes in our conventional medicine, or, doctors have only so much time with their patients. And so through further education in integrative and functional medicine, I help guide my patients towards a better understanding of how their hormones, their gut health, stress, toxin exposure, and other lifestyle factors can really be influencing their situation and their health.
That's such a need out in the community. So thank you so much for what you do. And I'm wondering, what are some themes that you see with the patients that you work with?
Yeah, so there's really a lot. And sometimes there's some overlapping themes depending on, who I'm seeing. But really in both pregnant and postpartum moms are just exhausted. And they don't have the energy to really show up for their family in the way that they want to be. So that's definitely a very big concern that I see. And, let alone having the energy to really consistently take care of themselves, preparing meals for themselves, caring for themselves and their family. That could be even, pregnancy symptoms getting in the way of that. They're nauseous and vomiting all the time, and they can really barely even eat, or maybe they're just craving a better balance of foods and they don't really know what meals and snacks to make that they can do in a timely fashion. We're busy moms, we don't have time to be cooking all day.
Yes.
Supplements are also something that I often talk about, that I see in themes, moms just don't really know what's necessary. The supplement industry is always pushing us with messages of you need this. And it's well, what do I actually need?
Yeah.
Especially if they're breastfeeding, some moms are really wanting more support, or they have this feeling like they need more support through supplementation or galactagogues or whatever that might be, to just help support healthy milk production for their baby. And then also just preparing for an easy postpartum recovery, especially in my veteran moms, where this isn't their first baby and maybe they had a bad experience last time. They want to be better prepared. I see this a lot with moms that have had experiences with postpartum depression or anxiety that got really bad, and now they're pregnant again, and they want to make sure that they're setting themselves up for, a better physical and mental recovery after this next birth.
So how does nutrition and proper nutrition help support with the energy and with postpartum and with an easier pregnancy?
Yeah, so pregnancy and postpartum is no doubt a nutritionally expensive time in our lives, when we are not only, still trying to maintain our normal body functions, but then some. We're also growing a baby, or we're, maybe producing milk for that baby. And outside of that, whether you're breastfeeding or not, birth is really a marathon, and it takes a lot of our nutrient stores, away. And so we're entering this postpartum period depleted. Even if we were, really on top of our game during pregnancy, we were really nourishing ourselves, a lot of those nutrient stores get depleted, or really, taken and used up during birth and that initial postpartum recovery. And so you may have heard of the postnatal depletion. And so this is really that idea that we really need to still take care of ourselves in the postpartum period, after baby is no longer with us physically, but we are still caring for ourselves and caring for that baby. And what research has found is that when we are, that postnatal depletion, especially in, if we're talking about postpartum specifically, if we aren't really filling those nutrient stores or nourishing our bodies in this way, it can really put us up for risk for postpartum mood disorders. And, some people ask like, well, how long are we postpartum?
Yeah.
Really a long time. It can take a long time for our body to recover from pregnancy and childbirth. And this is one of the reasons why they recommend spacing out pregnancies, a certain period of time, because we really need to allow time for that recovery. And then, that gets into the topic of like that whole bouncing back.
Yeah, that's just what I was thinking about. How does that influence if we're bouncing back, but we're depleted?
Mm-hmm.
How does that fit together?
Yeah, well, there is no bouncing back, right?
Mm-hmm.
It's like a myth. And I think,
share more about that. What is that myth?
Yeah, so I think society, especially in America, I don't see this as much in other countries where mom is really prioritized, like healing of mom and her bond with baby is really prioritized in other countries. In some traditional cultures, they still kind of have that sense of a village, and they come and they take care of mom, and mom is just kind of like resting for like the first 40 days or, for the first couple weeks after childbirth. Whereas, in America, it's a completely different story. We send moms home with their babies, or maybe they had a home birth and they have more of that kind of time to rest. But it's almost like after, just in this kind of rat race culture that we're in, it's like after the first week, we feel like we don't have permission to rest, and we have to, get back into it. Or, sometimes moms have to go back to work right away.
Yeah.
Or within even as soon as like the 6 weeks or sooner, because we don't have that support. And so I think that kind of feeds that sense that we need to bounce back. Like our bodies need to be prepared to take on the world and take on all these other tasks that we were doing. Or, you talk about like our bodies, like looking like bouncing back, like losing the baby weight. And, like I was saying, it takes a long time for our bodies to recover. If we try to kind of get into this diet culture and start to lose weight sooner than our body's really ready, or, traditionally people that try to lose weight are restricting their calories really low. I've seen some moms in my practice eating as few as like 1,000 to 1,200 calories a day, and they're wondering why their body's not producing milk. They're wondering why they feel so tired all the time, like their metabolism is really hurting. And so, it's hard because we have all these outside pressures of like, you need to be taking care of your family, or you need to be like sexy and like look a certain way. And that all kind of like depicts what bouncing back looks like in our culture. And it's really taking any focus off of like really just nourishing your body and recognizing everything that your body just went through and honoring that time for yourself. You know what I mean?
Yeah. So with nourishing your body, is will my nourishment look the same as the woman next to me, or is each nourished body, is it unique?
Yeah, I mean, really, health in general is very individualized, and we can have some kind of common recommendations for moms across the board. But if we really want to be feeling our best, that individualized support is really needed. For example, a woman that has a cesarean delivery versus a woman that has a vaginal delivery, their nutrient needs are a little bit different than each other. Or a woman that had a vaginal delivery with no tearing compared to a woman who had an episiotomy, like that in of itself is going to be different. A woman that's breastfeeding versus a woman that's not. A woman that is having a lot of health complications during her pregnancy versus one that's not. A woman that is just doing some generalized support for preconception versus a woman that's been struggling with hormonal issues, endometriosis, PCOS, irregular periods or really painful periods. Like all of those nutrient needs, or what their health, like what their body is needing, the level of support is going to be a little bit different.
So does a person who receives nourished food and the nutrients that they need, does that end up impacting their mental health?
Absolutely. There's a lot of research to support our vitamin D status, what our microbiome looks like down to the specific types of bacterial strains that are present in our gut, even like our kind of inflammatory state, and so that's why things like fish oils, EPA, DHA is really important for supporting mood, vitamin D, and getting those levels up to where they need to be. And that's something that I definitely assess in my practice is where are we at with certain lab work, and looking at it from a functional like lab stance as opposed to kind of the conventional standards for where certain labs should be. And then also just supporting gut health too, because we know there's such a strong connection now between the gut and the brain.
Yeah, definitely, definitely. And what's the difference between a nutritionist and a dietitian? And with you being specialized in pregnancy and postpartum, is every nutritionist the same?
That's a great question. And I think one that as a society and even in the medical field, we don't always like recognize or know. So nutritionists, I don't even know how many different types of certifications for nutritionists out there.
Okay.
But they're not standardized across the board.
Okay.
So like there might be certain nutrition programs that take a long time to get. There might be certain nutrition programs that it's just kind of like a very short course. It's not a regulated term, so anybody could call themselves a nutritionist. Even other medical providers can call themselves a nutritionist without any kind of certification.
Oh, wow.
A registered dietitian is a certification, and it is requires a degree. It requires an internship similar to like nurses. So usually I think it's about like 1,200 hours. So when I went through schooling, it was a 4-year program, which now they're moving into like a master's level program.
Okay.
And then you do an internship for about a year after that. And then you sit for a national standardized exam. So the exam to become a dietitian and to be certified is the same across the board for all dietitians. Whereas with a nutritionist, maybe it's just a class that you take and then you get a certificate. Maybe it does have some kind of test or exam. So it's the difference between, more standardized education versus not. And even then, I do think whoever somebody works with, it's important to know kind of what their specialties are, maybe some of like the continuing education that they've been doing, because that's also another thing as a dietitian, I'm required to recertify every couple of years. And within that period of time, I have to be doing continuing ed. That might not be the same for like nutrition certifications. It might last for a certain period of time. The recertification process might be different. Now, similar with lactation consultants, there are different types of lactation professionals out there. The IBCLC is kind of considered the gold standard. It's the one that requires the most education. Typically, there are a couple of different pathways to becoming a lactation consultant. The pathway that I took was being a health professional because it requires you to take most of the pathways. I think all of them require you to have some sort of like anatomy, biology, kind of scientific coursework, college level coursework, and then you do supervised training. I believe for me it was about 500 hours, and then also continuing ed to sit for an exam. And then whether or not you pass the exam depends on whether you become an IBCLC.
Wow. And I would assume that a lot of your continuing education is related to pregnancy, postpartum, and supporting that population.
Yeah, absolutely. And, as the nutrition side of things, I've definitely been pursuing more continuing ed in kind of the functional nutrition as it pertains to women's health too. And with lactation consultants, they have their own kind of continuing ed as well. But dietitians can do all sorts of things. Dietitians can go into, renal therapy for kidney patients. They can go into cancer. They can go into school nutrition. They can go into food service in hospitals. So there's lots of different things that dietitians do. And I chose to kind of go the private practice route and focus in on women's health.
and such an important need. So thank you so much for going in that direction, in that pathway. Do you have any recommendations? Like if you had a magic wand and you could say, okay, society, like this is what we need to be doing for our pregnant women and for our postpartum, our postpartum mothers, what would you recommend? What would you like to see?
Oh man, that's a really good question. I think we need to, in the medical field, I think we need to do better about shifting to a preventative approach instead of like what some people refer to as sick care. I think there's not a lot of education there on what providers can do, or maybe some providers are getting that training and some providers are just not. But I think we need to do better about looking deeper at root causes, specifically like hormones, because there are a lot of medications out there that I have seen providers throw out at moms and women, and it just kind of masks symptoms, and it doesn't actually solve problems. It doesn't make them feel better. But I think as a society, like we need to do better about looking at preventative care and root cause treatments, as well as just supporting mom's sacred time of healing in the postpartum period. And that comes with, supporting maternity leave, making it easier, that transition easier if moms do choose to go back to work. So I know that's not necessarily one thing, but comparatively, we aren't doing so great compared to some other places when it comes to supporting moms in the postpartum period.
Well, I think those are some great suggestions. Anything else that you're wanting to share with the audience today?
Yeah, so if anyone is interested, I do nutrition coaching online. My practice for nutrition is completely virtual. So you can visit my website at nourishedmothers.com and fill out my contact form or fill out an application to look into coaching. Typically, I work with my patients for 3 months at a time so that we can really get to know each other and dive into that, because there's a lot that we can't really just cover in one visit. So I do have a nutrition coaching program that I provide that's virtual. And if anybody has any questions about what that might look like, or you just want to know some generalized nutrition tips, you can find me on Instagram and Facebook at Nourished Mothers, and I'd be happy to connect.
Yeah, and I'll include all of that information below, so that people can get in contact with you. And people are also free to leave comments below. Give us a thumbs up if you liked this interview. And if you haven't subscribed yet to Mind and Body Pilates, a wellness approach, you could click on the Mind and Body Pilates logo below. Thank you so much for being here today.
Yeah, thanks, Michelle.